Infectious diseases, preventive medicine and clinical species conferences. Pneumonic pasteurellosis by definition, refers to infection of the lungs with organisms of the genus Pasteurella. The term pneumonic pasteurellosis has served conveniently since the 1960s, as a means of speaking collectively of pneumonias, caused by Pasteurella haemolytica and Pasteurella multocida without committing oneself as to the relative importance of the two agents. With the reclassification of P. haemolytica biotype A strains, as Mannhemia haemolytica, pneumonic pasteurellosis is an inappropriate name for pneumonia caused by both agents, however, its use is still widespread. The terms mnemonic mannhemiosis and pneumonic pasteurellosis should be used to separate the diseases caused by the two bacteria, M. haemolytica and P. multocida, respectively. Although these organisms can cause disease in young calves, as a component of enzootic pneumonia of beef, dairy, and veal calves, pneumonic mannhemiosis and pasteurellosis are a far greater problem in recently weaned beef calves shortly after entry to feedlots or after long shipments of various kinds as a component of shipping fever or undifferentiated bovine respiratory disease. Economic losses to the North American feedlot industry, due to respiratory disease, have been estimated to be as high as $1 billion annually, and losses to the beef industry in the UK have been estimated at £70 million annually. Morbidity rates of 15 to 45% and mortality rates of 1 to 5% are common in newly received feedlot calves. It is estimated that 75% of the morbidity and 50 to 60% of the mortality are attributable to respiratory diseases. The major bacterial pathogen involved in beef cattle respiratory disease is M. haemolytica, whereas P. multocida is less frequently involved, but is often the major pathogen in young dairy calf pneumonia. Despite of continuing intensive research to develop efficacious vaccines and improved management programs to prevent pneumonic pasteurellosis in feedlot cattle, success to date has been limited and control of bovine bacterial pneumonia still relies heavily on antibiotics as preventative measures and for treatment. Mannhemia haemolytica and P. multocida are gram-negative, non-motile, non-spore-forming, fermentative, oxidase-positive, facultative anaerobic short rods or coccobacilli of the family Pasteurellacea. Bipolar staining can be demonstrated using right stain. Both grow best in media supplemented with serum or blood. M. haemolytica grows on McConkey agar, but P. multocida does not. After 24 hours incubation on bovine or ovine blood agar plates, colonies of M. haemolytica are round and grayish, with a variable area of sharp S-hemolysis, which can be small, requiring scraping of the colony from the agar to visualize. Colonies of P. multocida are generally round, grayish and non-hemolytic with more heavily encapsulated strains appearing mucoid. Mannhemia haemolytica was originally named Pasteurella haemolytica, and two biotypes, A and T, along with 17 serotypes and numerous untypable strains were identified. In 1990, biotype A strains were found related by DNA homology, and biotype T strains were related. However, biotype A and T strains had little genetic relationship. Biotype T strains became Pasteurella triholosi and later Bibersteinia triholosi. Through DNA hybridization and 16S RNA sequencing, all but one of the A biotypes were designated M. haemolytica. Therefore, M. haemolytica consists of the previous P. haemolytica biotype A serotypes 1, 2, 5 to 9, 12 to 14, 16 and 17. Because all M. haemolytica serotypes are derived from biotype A, the designation of M. haemolytica serotypes is A1, A2, often continues, even though it is redundant to include the biotype designation. Serotypes 1 and 6 are the most commonly isolated from BRD. Pasteurella multocida has been classified into 5 serogroups, A, B, D, E and F, based on capsular polysaccharide antigen and 16 serotypes, 1 to 16, based on lipopolysaccharide. Most P. multocida isolated from bovine respiratory disease are A serogroup, with A:3 being the most common. The importance of M. haemolytica and P. Multocida and pneumonia of feedlot cattle was suspected in early studies because of their frequent isolation from clinical cases and necropsy specimens. Doubts arose, however, as to whether these agents were primary pathogens, due to difficulties in reproducing clinical disease, and pulmonary lesions experimentally, and because bacterians did not mediate protection. Identification of numerous pathogenic bovine respiratory viruses, that cause lesions or impair clearance of bacteria, from the lower respiratory tract, encouraged the view that infection with viruses or perhaps Mycoplasma spp, especially Mycoplasma bovis, was a necessary prelude to pneumonia with M. haemolytica or P. multocida. Bovine herpes virus 1, that is also called infectious bovine rhinotracheitis virus IBR, parainfluenza 3 virus, bovine respiratory syncytial virus, bovine virus diarrhea virus, and more recently bovine coronavirus have been implicated as predisposing to bacterial pneumonia. Challenge models employing primary infection with BOHV or PIV3 virus followed by M. haemolytica or P. multocida have been used in studies of pathogenesis and vaccine efficacy. It was demonstrated, however, that fibrinous pneumonia could be induced in calves using logarithmic growth phase M. haemolytica or P. multocida alone, when sufficient numbers of bacteria are delivered to the lungs, by intratracheal or transthoracic routes, in non-immune calves. In addition, an exotoxin, leukotoxin, specific for ruminant leukocytes was demonstrated in M. haemolytica, establishing that bacterium as a primary pathogen in shipping fever pneumonia. Research has focused on M. haemolytica serotype 1, S1, as the serotype most commonly isolated from cattle with pneumonia, although S6 is involved approximately 20% of the time. In addition, S1 is the dominant serotype in the nasal passages of feedlot calves with acute respiratory disease. Although P. multocida has been shown to induce pneumonia, when delivered to the lungs in large numbers, pulmonary lesions associated with this organism are usually not those of fulminating fibrinous pneumonia. Fibrin and necrotic foci can be present, however, lesions are more typically suppurative bronchopneumonia, and as with both bacteria, severity of lesions may be somewhat strain-dependent. Pasteurella multocida has, therefore, been relegated to a secondary role in pneumonia of feedlot calves, although it may be relatively more important as a primary pathogen in disease of young dairy calves. Epidemiological studies of pneumonic pasteurellosis in feedlot calves have been hampered by the difficulty of distinguishing, at the clinical diagnosis level, respiratory disease caused by M. haemolytica or P. multocida from that caused by other bacterial and viral agents. This has led to the use of the term undifferentiated bovine respiratory disease, more simply bovine respiratory disease complex, or even undifferentiated fever. Case definitions of clinical respiratory disease have been general and subjective. Clinical diagnosis of BRD also lacks sensitivity in identifying affected animals. A meta-analysis found an estimated pooled sensitivity of clinical diagnosis of 0.27, with a 95% credible interval of 0.14 to 0.92. Because of this difficulty in differentiating causative agents, or even disease processes, studies may rely upon total morbidity as an outcome measure in field studies. Even this approach may underestimate the incidence of BRD, as many untreated cattle demonstrate lung lesions at slaughter. Mortality is more objective than morbidity, but does not identify all affected cattle. Mortality is likely not sensitive enough to facilitate study of most variables of interest. In addition to assessing morbidity and mortality, studies examining efficacy of products or interventions in controlling BRD may also examine production variables, such as average daily gain, feed efficiency, and cost-benefit analysis. Historically, the stresses of weaning, adverse weather conditions, change in feed, transportation, and mixing of cattle from diverse sources, have been considered to contribute to the high incidence of respiratory disease observed in recently weaned and assembled feedlot calves. The close association of these events in time has complicated efforts to identify causal relationships. Numerous studies have been conducted to attempt to elucidate the relationship of these practices with BRD, often yielding conflicting or inconclusive results. Weaning prior to shipment appears to be more important than vaccination in preventing BRD. Shipment is clearly associated with disease occurrence, but no clear association has been found regarding distance of transport, method, or location within transport trailer. Seasonal variation is commonly noted, but this may be confounded by a variety of factors, including typical management practices that result in large numbers of freshly weaned calves being marketed in the autumn. No clear or compelling association can be identified with weather, either. Commingling of calves from multiple sources appears to increase BRD risk, as seen in several studies. Higher BRD morbidity and mortality are commonly associated with lighter weight at purchase/arrival, which is assumed to correlate with younger age. Bovine respiratory disease onset within a population of calves coincides with a typical incubation period of common infectious agents, 7 to 10 days after initial stressors, with a peak around 2 weeks after arrival. If calves become ill or die more abruptly than that, it is likely they were incubating disease prior to arrival. Historically, morbidity and mortality begin abating soon thereafter, with median time of mortality being approximately 3 weeks after arrival. For unknown reasons, however, there appears to have been a shift in epidemic curves since the 2000s, with certain classes of cattle having a relatively large percentage of BRD cases occurring later in the feeding period. Heifers are at a modestly increased risk for BRD as compared to steers. Bulls that are castrated after arrival at the feedlot are also at greater risk of BRD than steers castrated and healed prior to purchase. It has been questioned whether pneumonic mannhemiosis and pasteurellosis in feedlot calves should be considered highly contagious diseases. Although morbidity rates as high as 69% have been reported in the first weeks after feedlot arrival, it has been observed that fibrinous pneumonia does not sweep through the feedlot like an epidemic but centers on certain pens. This would suggest that characteristics of the calves in the various pens rather than mere exposure to M. haemolytica are critical in determining disease outcomes. In an experimental study, 50% of non-challenged control calves, in contact with animals challenged with M. haemolytica developed clinical signs of pneumonic mannhemiosis and responded serologically, but it is unclear how well this reflects transmission under field conditions. More recent molecular characterization techniques have shown limited dissemination of clonal strains of M. haemolytica throughout the nasopharyngeal microflora within a large population. Molecular approaches have also found certain strains are more commonly associated with BRD. Despite the value of this finding, it is unlikely that hypervirulent versus less virulent bacterial strains is a notable variable in defining the epidemiology of BRD. Most recently, molecular studies have focused on the bovine respiratory microbiome with respect to what are the normal nasal, nasopharyngeal, and tracheal microbial flora and what influence various procedures, stresses, age, and feeding period have on that flora. Several studies found differences in the microbiome of calves that remained healthy compared to calves treated for clinical BRD. They concluded that although there were changes in the flora, individual animal variation prevented any conclusions concerning disease potential. Additional questions include how stressors impact the microbiome. Another recent study found no significant influence of transportation or commingling of cattle on composition of the nasopharyngeal or tracheal microbial flora. In contrast, a single injection of oxytetracycline or tulathromycin upon entry to the feedlot resulted in measurable changes in nasopharyngeal microbiota. Those same authors found distinct differences in nasopharyngeal and tracheal microcolonies in healthy cattle, and pen mates with pneumonia with a higher abundance of M. haemolytica and P. multocida in pneumonic, compared to healthy cattle. Pathogenesis. The vast majority of studies of the pathogenesis of pneumonic mannhemiosis or pasteurellosis have been in the context of M. haemolytica. It has not been clearly demonstrated whether similar processes are responsible for disease associated with P. multocida. Stress-related factors such as weaning, adverse weather conditions, change in feed, transportation over long distances, and mixing of cattle from various sources have long been associated with pneumonic mannhemiosis and pasteurellosis in feedlot calves. Cold stress, chilling of calves with cold water, increases plasma cortisol levels transiently, but does not affect histamine or bradykinin levels. Enhanced proliferation of M. haemolytica in the nasopharynx of calves following an abrupt change in climate from cold and dry to warm and humid has been noted, and that may be related to the effects of stress-related chemicals such as epinephrine on M. Haemolytica biofilm dispersal. Transporting recently weaned calves leads to the elevation of plasma cortisol levels for 3 days or more and depressed lymphocyte blastogenic responses. Transporting heifers during high ambient temperatures increased plasma cortisol and modified behavior. Decreases in serum complement activity, as calves move from the auction market to the feedlot have been documented. Transportation and weaning stress decreased the number of T lymphocytes, shifted dominant immune responses from Th1 to Th2, and caused neutrophilia, due to release of immature neutrophils from the bone marrow, decreased neutrophil margination along endothelial lining of vessel walls, and a decrease in neutrophil apoptosis. The effects of mixing of calves, during transportation to the feedlot or after sorting at the feedlot, on the prevalence of respiratory disease may result from the stresses of interacting with strange calves, or may reflect increased opportunities to contact infectious agents. Both M. Haemolytica and P. multocida constitute part of the normal flora of the nasopharynx of healthy calves, where they exist in polysaccharide biofilms, but may be undetectable or detected in low numbers by routine culture. Although these pathogens are present in the nasopharynx, recent studies indicate their absence from the paranasal sinuses. Changes in the flora of the nasopharynx of calves from before weaning until after arrival at the feedlot. Tonsillar tissue, specifically, has been identified as a reservoir for M. haemolytica. Calves may be negative for M. haemolytica on culture of nasal swabs, but positive on culture of the tonsils. Not only does the frequency of isolation of M. haemolytica S1 increase as calves move to the feedlot, but the number of bacteria also increases rapidly. When high numbers of M. haemolytica are present on the nasal mucosa of calves, the bacteria are inhaled into the lungs, although they are not present in exhaled air. In healthy calves, lung clearance of inhaled M. haemolytica is highly efficient, with the elimination of 90% of an administered dose within 4 hours. Infection with PIV3 virus or BOHV1 can lead to the proliferation of M. haemolytica in the nasopharynx of calves that had previously reduced their numbers of M. haemolytica to undetectable levels. Virus infection will mediate colonization of the nasal passages by M. haemolytica or P. multocida even in the presence of detectable titers of antibodies in serum and nasal secretions. Exposure of bronchial epithelial cells to BOHV1, M. haemolytica, or both causes marked inductions of genes responsible for inflammatory processes. Increased elastis activity in the mucus of the nasal passages was documented in calves following experimental infection with BOHV1, and preceding colonization by M. haemolytica. Elastis may act by cleaving fibronectin on the surface of epithelial cells, permitting colonization by gram-negative bacteria. Pasteurella multocida outer membrane protein OMP has been shown to enhance colonization by binding to fibronectin. Infection with PIV3 virus leads to impaired clearance of bacteria from the lungs. Bovine herpes virus 1, PIV3 virus and bovine virus diarrhea virus have been shown to impede ciliary activity of tracheal epithelial cells in vitro. There is experimental evidence that neutrophils play a considerable role in the induction of lung lesions following infection with M. haemolytica. Calves depleted of neutrophils before challenge with live M. haemolytica have minimal or reduced lung lesions. The contents of primary and secondary granules, as well as cytosolic enzymes, are released from bovine neutrophils following exposure to live M. haemolytica or its leukotoxin, mediating acute lung injury. Pulmonary intravascular macrophages and alveolar macrophages are also important mediators of inflammation in early lung lesions. Multiple products and components of M. haemolytica S1 have been suspected as virulence factors, including adhesins, capsular polysaccharide, fimbriae, iron-regulated outer membrane proteins, leukotoxin, lipopolysaccharide, lipoproteins, neuraminidase, a serotype-specific antigen, siloglycoprotease, egoprotease, and transferrin-binding proteins. The adhesin protein, capsular polysaccharide, fimbriae, siloglycoprotease and neuraminidase may have roles in the attachment of M. haemolytica and its colonization of cells of the respiratory tract of calves. The capsular polysaccharide also has anti-phagocytic properties, and increases directed migration of neutrophils. The sialoglycoprotease, by cleaving bovine IgG1 or host cell surface proteins, may reduce the effectiveness of opsonizing antibodies and enhance colonization. Transferrin-binding proteins and other iron-regulated proteins enable M. haemolytica to proliferate in vivo despite of the low iron environment normally maintained by the host. Lipopolysaccharide as an inducer of inflammation has a central role in the development of vascular lesions in lung tissue and activation of pro-inflammatory mediators. Leukotoxin has multiple effects on bovine leukocytes, mediating cell death by both cytolytic and apoptotic mechanisms. Lower concentrations of leukotoxin inhibit lymphocyte, blastogenic, responses and reduce the chemiluminescent and bactericidal responses of phagocytic cells. Lytic effects on platelets contribute to the exudation of fibrin and formation of thrombotic lesions in infected lung tissue. In summary, colonization, or recolonization, of the upper respiratory tract of calves by M. haemolytica, may occur rapidly during the process of weaning, marketing, transportation and admission to a feedlot. Environmental factors and/or viral infection may facilitate the dramatic increase in population of M. haemolytica in the nasopharynx. Inhalation of M. haemolytica in increased numbers, in association with stress or virus-associated impairment of bacterial clearance, permits rapid proliferation of the bacteria in the lungs. The influx of neutrophils in response to the presence of lipopolysaccharide and capsular polysaccharide is followed by lysis of these cells due to the effects of leukotoxin, with the release of the contents of primary and secondary granules. This event, in combination with inflammatory effects due to lysis of platelets by leukotoxin and the effects of lipopolysaccharide and leukotoxin on alveolar and intravascular macrophages, leads to vascular damage, exudation of fibrin, the development of edema in the alveoli and interlobular septa, and the accumulation of fluid and fibrin in the thoracic cavity. The compromising of the vascular supply soon leads to necrosis of affected areas of lung parenchyma. Suppurative bronchopneumonia occurs when bronchial colonization with P. multocida initiates suppurative bronchitis with progressive spread along airways resulting in an obviously bronchial-centered lesion within each lung lobule. Isolates associated with BRD are usually serogroup A, whereas serogroups B and E are associated with ruminant hemorrhagic septicemia. Serogroup D strains, as well as some serogroup A strains, can produce a cytolytic toxin, Pasteurella multocida toxin, dermonecrotic toxin, that is associated with atrophic rhinitis of pigs. Strains of P. multocida serogroup A that are heavily encapsulated have been shown to resist phagocytosis and killing by bovine neutrophils. Lipopolysaccharide of P. multocida has carbohydrate moieties that are similar to the carbohydrate component of host glycoproteins, making it likely that LP's mimicry of host molecules could play a role in the survival of P. multocida in the host. P. multocida LPs and outer membrane proteins interact with TLR4 and CD14, stimulating release of numerous pro-inflammatory cytokines. In a dose and time-dependent manner, P. multocida LPs can also stimulate leukocyte proliferation and leukocyte death via mitochondrial dysfunction and caspase activation. Expression of various genes for adhesins, outer membrane proteins OMP and OMF, iron-regulated membrane proteins, and hemoglobin-binding proteins have been shown to be different between virulent and less virulent P. multocida strains and among strains from different hosts. Clinical signs in calves following experimental challenge, with M. haemolytica or P. multocida closely resemble those occurring in feedlot calves with pneumonic mannhemiosis, pasteurellosis effects due to M. haemolytica are generally more severe than those due to P. multocida. Observed signs in calves challenged by the intratracheal route include depression, drooping ears, reluctance to move, inappetence, increased respiratory rate and effort, moist rails on lung auscultation with occasional moist coughing, and recumbency. A serous to mucoid or purulent nasal discharge may be present. Rectal temperatures over 40 degrees Celsius are common and may be as high as 41.5 degrees Celsius. The naturally occurring disease in feedlot calves may be acute and fulminating, with calves dying before they are detected as ill by feedlot personnel or taking a more chronic course. Increased lacrimation is common, and mucopurulent nasal discharges may result in encrusted muzzles. Dyspnea in severe cases may lead to oral breathing with an expiratory grunt. Calves may adopt a distressed stance, with elbows abducted and neck extended. Moist rails may progress to dry rails and pleuritic friction rubs. During a disease outbreak, up to 20% or more of calves that appear clinically normal may have fever of 40 degrees Celsius or more. Some of these will progress to be patently ill, while the rest will recover without treatment. The lesions associated with pneumonic mannhemiosis are basically those of fibrinous pleuropneumonia. Commonly, the cranioventral 1 to 2/3 of the lung are bilaterally consolidated and of firm and heavy consistency. Hepatization. Lobules in the affected areas are red, gray, or nearly black, and in a spectrum of stages of the pneumonic process, imparting an appearance to those areas that have been described as marbled. A clear separation exists between pneumonic and non-pneumonic areas of the lung. Acute fibrinous or serifibrinous pleuritis often accompanies the pneumonic lesions, with sheets of fibrin loosely or firmly adherent to the parietal and visceral pleura and/or pericardium. Large volumes of straw-colored thoracic fluid are occasionally encountered. Edema and deposits of fibrin distend the interlobular septa in affected areas, and interlobular lymphatic thrombi may be visible. In chronic lesions, numerous areas of coagulative necrosis are present, delimited by pale fibrous tissue. This fibrous capsule becomes progressively thicker with time in calves surviving the acute disease process. Fibrin deposits in the pleural cavities may become organized to form extensive fibrous adhesions. Gross lesions of pneumonic pasteurellosis are most commonly seen in BRD of young dairy calves, and most often associated with P. multocida infection, though other respiratory bacteria may also produce the lesion. Suppurative bronchopneumonia occurs when bronchial colonization of bacteria initiates suppurative bronchitis, with progressive spread along airways resulting in bronchial-centered lesion within each lung lobule. The pneumonia is bilateral, cranioventrally distributed, and moderately firm. In acute lesions, affected lobes are fairly uniform in color, varying from pink, pink-gray, dark red, red-gray, or gray with minimal to mild interlobular septal edema. On cut surface within lobules, there are variably sized, partially discrete tan to gray foci indicative of a pattern of bronchiolar and parabronchiolar inflammation from which purulent to mucopurulent exudate can often be expressed. Pleuritis is usually not present, however, if present, it consists of small foci of pleural dullness to small clusters of fibrin strands. Remaining areas of lobules are pink to dark red, representing various amounts of inflammation, congestion, and atelectasis. Histological lesions of pneumonic mannhemiosis vary with the stage of progression of the disease. In experimental cases, neutrophils, macrophages, edema and fibrin are prominent in the alveoli by 6 hours post-inoculation. Subsequently, edema, fibrin and congestion or hemorrhage become more prominent in the alveoli. At a later stage, swirly or streaming or oat-shaped dark staining macrophages with pycnotic, hyperchromatic nuclei are typically found in the injured alveoli. Large areas of coagulative necrosis, often involving nearly entire lobules, surrounded by degenerating and intact leukocytes and fibrin, are often present. Thrombosis of septal lymphatic vessels is present in severe cases. Arterial thrombosis is often present in more subacute to chronic lesions. Histologic lesions of pneumonic pasteurellosis are classical, suppurative bronchopneumonia characterized by bronchioles and adjacent alveoli distended with degenerating and viable neutrophils, fibrin, and protein-rich edema. Segmental necrosis of bronchiolar epithelium may be present along with intraalveolar hemorrhage. Over time, macrophages and lymphocytes increase within bronchioles and alveoli. Foci of necrosis may occur within affected alveoli, which may progress into foci of abscessation. Ante-mortem suspicion diagnosis of BRD is typically based upon signalment, history, and clinical signs. For recently weaned, newly received feedlot calves, antibiotic treatment is usually initiated based on clinical signs without awaiting an etiological diagnosis, because of the high incidence of pneumonic mannhemiosis and pasteurellosis in this class of calves and the expected rapid progression of disease signs. Suspicion increases with increasing epidemiological risk factors, as outlined above. History is often incomplete, as calves are typically purchased at auction markets and commingled, with no knowledge of prior management practices. Various clinical scoring systems have been devised, with the most common using a combination of criteria involving evaluation of depression/mental obtundation, appetite, manifested as room and fill, as well as approach to bunk when feed is delivered, respiratory signs, including nasal discharge, coughing, respiratory effort, and dyspnea, and body temperature. While these criteria are in no way specific to bacterial pneumonia, antibiotics are commonly administered even when a viral agent is suspected, in order to control secondary bacterial infections. More detailed examination of the respiratory are not practiced, since, in general, BRD is easy to distinguish from more discrete feedlot health issues. The exception to this is ruminal acidosis, which may mimic many of the non-respiratory signs, and even some respiratory signs. Clinical BRD diagnosis can be enhanced by detecting elevated serum acute phase proteins, particularly haptoglobin, and thoracic ultrasound evaluation. Culture of nasal swabs is of doubtful diagnostic value due to the high numbers of haemolytica present in the nasopharynx of newly arrived feedlot calves regardless of their health status, and the lack of correlation between nasal and lung isolates in individual calves. Bronchoalveolar lavage along with bacterial culture or multiplex PCR can give a better assessment of bacteria involved in pneumonia. Evaluation of results from antimicrobial susceptibility testing of isolates from affected lung, especially from untreated cases, may provide useful information for therapeutic decisions for the rest of the group. However, the correlation of susceptibility to clinical outcome is unclear. Respiratory conditions that may be mistaken for pneumonic mannhemiosis, pasteurellosis include pneumonia due to Haemophilus somni or Mycoplasma spp. Infection as well as bovine respiratory syncytial virus and BOHV1, or other viruses infecting the respiratory tract, interstitial pneumonias, and sporadic conditions, such as lung abscesses and aspiration pneumonia. The finding of fibrinous or fibrinopurulent bronchopneumonia on necropsy is highly suggestive of pneumonic mannhemiosis, although H. somni, also a member of the family Pasteurella, can cause fibrinous lesions. For a definitive diagnosis, culture or multiplex PCR of affected lung tissue is required. Control. Pneumonic mannhemiosis or pasteurellosis appears to largely be a management disease, resulting from incompatibility between the biology of calves and their microbiota, and the managing and/or marketing systems of humans. Calves that move directly from a ranch into feedlots without moving through sales yards, and without mixing with calves from other sources, can be expected to suffer notably lower morbidity than calves undergoing commingling, extended and/or repeated transport, or other stressors. While vaccines and antibiotics can be useful in controlling pneumonic mannhemiosis or pasteurellosis, basic changes in when and how calves are weaned, sold, and transported to feedlots would have a profound impact on the prevalence of disease. Despite this recognition, much uncertainty remains in understanding all contributing causes of BRD, and thus how to truly control its occurrence. One of the most consistent features of BRD is the enormous variability that can occur across operations following similar procedures, or even from year to year on the same operation. Thus, while producers should be encouraged to castrate at a young age, vaccinate, wean on the farm/ranch of origin, and perform other tasks commonly referred to as preconditioning, they should be warned that unexpected morbidity may still occur. Use of oral antimicrobials, either in feed or in water, to treat, control, or prevent BRD has been extensively examined. Products available for these purposes in the United States, U.S., include oxytetracycline alone, sulfadimethoxine, and other sulfa compounds, alone, oxytetracycline and sulfamethazine in combination, oxytetracycline and neomycin in combination, and tilmicicin. Evidence for efficacy of most of these products is minimal, and the regulatory environment in the EU and the US makes oral antimicrobials more difficult to justify and utilize. Emergence of antimicrobial resistance among M. haemolytica and P. multocida since the early 2000s has complicated treatment recommendations. Antimicrobial resistance is higher in bacterial isolates obtained from calves previously treated for BRD than from those collected from untreated calves. Vaccines intended for prevention of respiratory disease, in feedlot cattle, have been manufactured for nearly 100 years. Numerous commercial haemolytica and multocida vaccines are available worldwide. Evaluation of vaccine efficacy in calves against haemolytica and multocida requires controlled studies involving challenge with virulent bacteria. However, there are difficulties associated with those studies, in part because of problems in defining objective outcome measures, and because of difficulties in achieving adequate group sizes to obtain acceptable statistical power. Vaccine efficacy is also difficult to establish in field studies, in part because morbidity and mortality rates, infectious agents and stressors, and genetic makeup of cattle vary widely among studies. Programs to prepare cattle for entry to feedlots by pre-weaning, weaning 14 to 28 days before shipment off farm, or preconditioning, pre-weaning, castration, dehorning, and vaccination with selected vaccines 21 to 45 days before shipment, generally reduce BRD morbidity and mortality, but can still produce variable results. Certified precondition for health preconditioning programs for beef calves have been established in numerous states of the U.S. since the 1960s, but have made only limited impact on the feedlot industry. A review of controlled experiments of preconditioned calves found an average reduction in morbidity of 23% and a decrease in mortality of 0.7%. In general, economic benefits of preconditioning are derived from weight gain of calves during that time, rather than a premium collected at marketing. Accumulating evidence suggests that calves can be vaccinated successfully at a relatively young age in spite of persisting titers of maternal antibodies. Serum antibody responses to the leukotoxin and capsular polysaccharide of haemolytica S1 have been reported in dairy calves vaccinated at 6 and 8 weeks of age with a commercial culture supernatant vaccine. The results obtained in beef calves vaccinated at 3 and 5 weeks of age have also demonstrated significant increases in serum antibody titers post-vaccination. Vaccination of calves against respiratory viruses, in the presence of maternal antibodies, may induce immune priming with the potential for anamnestic responses after weaning. A management program of vaccination at branding combined with revaccination within a day of weaning could provide a means to maximize immunity by the time of feedlot entry, with minimal extra labor costs. In conclusion, given the current marketing procedures used in cattle industries, mannhemiosis, pasteurellosis pneumonia can be reduced and managed through use of vaccines, antibiotics and good management practices. Fowl cholera, avian pasteurellosis, is a commonly occurring avian disease that can affect all types of birds and is distributed worldwide. Fowl cholera outbreaks often manifest as an acute fatal septicemia, primarily in adult birds. Chronic and subclinical infections also occur. Chronically, it may cause lameness, swollen wattles, in chickens, pneumonia, in turkeys, and/or torticollis. However, birds can also be subclinical affected carriers. Both live, attenuated vaccines and adjuvanted bacterians are available to aid in prevention, and the organism is susceptible to some antimicrobials. Diagnosis depends on isolation and identification of the causative bacteria, Pasteurella multocida. Presumptive diagnosis may be based on the occurrence of typical clinical signs and lesions and/or on the microscopic demonstration of bacteria in blood smears, or impression smears of tissues such as liver or spleen. Mild or chronic forms of the disease also occur where the disease is endemic, with localized infection primarily of the respiratory and skeletal systems. Etiology and transmission. Pasteurella multocida, the causative agent of fowl cholera, is a small, gram-negative, non-motile rod with a capsule that may exhibit pleomorphism after repeated subculture. P. multocida is considered a single species, although it includes 3 subspecies: multocida, septica, and gallicida. Subspecies multocida is the most common cause of disease, but septica and gallicida may also cause cholera-like disease. In freshly isolated cultures or in tissues, the bacteria have a bipolar appearance when stained with right stain. Although P. multocida may infect a wide variety of animals, strains isolated from most non-avian hosts generally do not produce fowl cholera. Strains that cause fowl cholera represent a number of immunotypes, or serotypes. P. multocida can be subgrouped by capsule serogroup antigens into 5 capsular types, A, B, C, D, and F, and into 16 somatic serotypes. Turkeys and waterfowl are more susceptible than chickens, older chickens are more susceptible than young ones, and some breeds of chickens are more susceptible than others. Chronically infected birds and subclinical carriers are considered to be major sources of infection. Wild birds may introduce the organism into a poultry flock, however, mammals, including rodents, pigs, dogs, and cats, may also carry the infection. However, the role of these as a reservoir has not been thoroughly investigated. Dissemination of P. multocida within a flock and between houses is primarily by excretions from the mouth, nose, and conjunctiva of diseased birds that contaminate their environment. Pecking and cannibalism of infected carcasses contributes to spread of the organism through affected flocks. In addition, P. multocida survives long enough in the environment to be spread by contaminated crates, feed bags, shoes, and other equipment. The infection is not egg-transmitted. Clinical findings from fowl cholera vary greatly, depending on the species and age affected and the course of disease. In acute fowl cholera, finding a large number of dead birds without previous clinical signs is usually the first indication of disease. Mortality rate often increases rapidly. In more protracted cases, listlessness, anorexia, mucoid discharge from the mouth, ruffled feathers, diarrhea, and increased respiratory rate are usually observed. Pneumonia is particularly common in turkeys. In chronic fowl cholera, clinical signs and lesions are generally related to localized infections of the sternal bursae, wattles, joints, tendon sheaths, and foot pads, which often are swollen because of accumulated caseous or fibrinous exudate. There may be lameness, as well as exudative conjunctivitis and pharyngitis. Torticollis may result when the meninges, middle ear, or cranial bones are infected. Although the history, clinical signs, and lesions may aid field diagnosis of fowl cholera, isolation of P. multocida is the standard for confirmation. Primary isolation can be accomplished using media such as blood agar, dextrostarch agar, or trypticase soy agar. Isolation may be improved by the addition of 5% heat-inactivated serum. P. multocida can be readily isolated from viscera of birds dying from peracute or acute fowl cholera, whereas isolation from suppurative lesions of chronic cholera may be more difficult. At necropsy, bipolar microorganisms may be demonstrated by the use of right or Giemsa stain of impression smears obtained from the liver in the case of acute cholera. In addition, immunofluorescent microscopy and in situ hybridization have been used to identify P. multocida in infected tissues and exudates. PCR assay has been used for the detection of P. multocida in pure and mixed cultures and clinical samples. This method may help identify carrier animals within flocks. However, the specificity and sensitivity of the test must be improved. Conventional serotyping suffers from problems with reproducibility and reliability, and the methods are quite laborious. A multiplex PCR assay has been developed that can differentiate between different somatic serotypes and may enable more efficient vaccine development. Serological testing can be done by rapid whole blood agglutination, serum plate agglutination, agar diffusion tests, and ELISA. Such testing may be used to evaluate vaccine responses but has very limited value for diagnostic purposes. Several bacterial infections may be confused with fowl cholera based solely on the gross lesions. Escherichia coli, Salmonella enterica, Ornithobacterium rhinotrachea, gram-positive cocci, and Erysipelathrix ruschopodii, erysipelas, may all produce lesions indistinguishable from those caused by P. multocida. For prevention of fowl cholera, rodents, wild birds, pets, and other animals that may be carriers of P. multocida must be excluded from poultry houses. The organism is susceptible to ordinary disinfectants, sunlight, drying, and heat. Adjuvant bacterians are widely used and generally effective. Because bacterians are only effective in preventing disease caused by the same serotypes included in the vaccine, somatic serotyping is important. Thus, it is important to know the most prevalent serotypes within an area. Autogenous bacterians are recommended when polyvalent bacterians are found to be ineffective. Live, attenuated vaccines are available for administration in drinking water to turkeys and by wing web inoculation to chickens. These live vaccines can effectively induce immunity against different serotypes of P. multocida. They are recommended for use in healthy flocks only. Treatment and control. A number of antibacterial drugs will decrease deaths from fowl cholera, however, deaths may resume when treatment is discontinued, showing that treatment does not eliminate P. multocida from a flock. Pecking and cannibalism contribute to spread of disease through a flock, therefore, prompt removal and disposal of carcasses is critical to decrease further losses. Eradication of infection requires total depopulation, cleaning and disinfection of buildings and equipment. The premise should then be kept free of poultry for a few weeks. When antimicrobials are used, early treatment and adequate dosages are important. Antimicrobial resistance testing should be used to guide drug selection because of the emergence of multi-resistant strains. Sulfamethazine or sulfadimethoxine in feed or water usually controls mortality rates. Sulfa drugs should be used with caution in breeders because of potential toxicity and cannot be used in hens laying eggs for human consumption. Oxytetracycline and chlortetracycline are labeled for control of P. multocida and may be useful. Penicillin is often effective in turkeys for sulfa-resistant infections but is not labeled for this indication. Pasteurellosis in sheep and goats. Respiratory disease is common in sheep and goats and is usually the result of a series of complicated interactions involving stress inducers, both physical and physiological, and a variety of infectious agents. The most common form of respiratory disease is pasteurellosis. In lambs and kids affected with the acute disease, the signs include fever, dyspnea, anorexia, recumbence, and sudden death. If the animals survive, they can become chronically affected with resultant reduced ability to thrive and survive further infections. Pasteurellosis can therefore have a significant impact on the productive efficacy of small stock. Although the main clinical form of pasteurellosis in sheep and goats is pneumonia, there is also a systemic form found only in sheep. The pneumonic form is caused by Mannhemia haemolytica, formerly designated Pasteurella haemolytica 1, and the systemic disease by Bibersteinia trihalosi. In sheep in temperate climates, Pasteurella multocida rarely causes pneumonia and little is known of the epidemiology of that infection. Pasteurellosis caused by M. haemolytica is one of the most common bacterial infections of sheep and goats, and by far the most important respiratory one, with a widespread distribution, occurring in temperate, subtropical and tropical climates. Etiology: in sheep, 2 Pasteurella species, M. haemolytica and P. trihalosi, share a common serotyping system comprising a total of 17 serotypes, with approximately 90% of all isolates serotypable. Each of the 2 species, originally biotypes of Mannhemia haemolytica, is associated with a distinct clinical syndrome. Mannhemia haemolytica strains are responsible for pneumonic pasteurellosis in sheep and goats of all ages. Pasteurella trihalosi strains cause a systemic disease in 6 to 10-month-old lambs. Mannhemia haemolytica and P. trihalosi are identical in their morphology, both being encapsulated, small, gram-negative, aerobic coccobacilli. In carbohydrate fermentation tests, it was originally thought that strains of M. haemolytica fermented arabinose, hence the former biotype A designation, but not trihalose, whereas all P. trihalosi strains ferment trihalose, hence the former biotype T designation. Colonies of M. haemolytica are small and gray with a narrow zone of hemolysis after 24 hours incubation. The colonies of P. trihalosi strains are darker, larger and have brownish centers. Disease associated with Mannhemia haemolytica, the predominant disease caused by this species is pneumonia. The prevalence of the serotypes varies. In the UK, 33% of all Mannhemia, Pasteurella isolates were serotyped as M. haemolytica A2, while A1, A6, A7 and A9 represented about 22% of the total. T10 is the commonest P. trihalosi serotype, 11%, followed by T15, 9%, and T4, 7%. Clinical cases associated with each species have a seasonal distribution, with M. haemolytica more prevalent in the spring and summer and P. trihalosi predominant in the autumn. M. haemolytica and P. Trachelosi occur in the nasopharynges and tonsils of apparently normal sheep. M. haemolytica predominates in the nasopharynx, whereas P. trachelosi is the major species in the tonsils. Most outbreaks of pneumonic pasteurellosis occur in spring to early summer in temperate regions, and many involve both ewes and lambs. Flock outbreaks usually start suddenly with deaths, often in young lambs in which the disease is hyperacute and septicemic rather than pneumonic. As lambs get older, the disease becomes more confined to the thorax with prominent lesions of pleuritis and pericarditis. In animals beyond 3 months of age, most cases are frankly pneumonic, although sudden deaths with septicemia rather than pneumonia may still occur. As the outbreak progresses over the next few days, a number of sheep will be noticed with clinical signs of pneumonia. Observations of the flock show that some sheep have an occasional cough and slight oculonasal discharges. Morbidity and mortality rates vary, but up to 10% of the flock may be affected. Pneumonic pasteurellosis also occurs in individual sheep sporadically rather than as part of a clearly defined flock outbreak. In most cases, flock outbreaks on individual farms are sporadic and do not occur every year, although on some farms small numbers of sheep may succumb annually. There is a tendency for the prevalence of the disease to be higher overall in some years than in others, for which there are two possible explanations. Either environmental factors, climate, are particularly favorable for the disease over a wide area in some years, or immunity to the predisposing virus infections are cyclical. It is generally assumed that environmental factors are important predisposing causes of pneumonic pasteurellosis, but precise epidemiological data are lacking. Some outbreaks can be linked to previous stressful situations such as warm or cold, wet weather, and dipping, castration or dosing. There is evidence from experimental investigations and epidemiological studies that infection with parainfluenza type 3, PI3, virus, respiratory syncytial virus, and sheep pulmonary adenomatosis are factors predisposing to pneumonic pasteurellosis. Infection with PI3 virus generally produces no or a mild illness, and cases of pneumonia in a flock can be attributed to a superimposed infection of the lungs with M. haemolytica strains. Similar to viruses, some respiratory bacterial infections also increase the susceptibility of sheep to secondary M. haemolytica infections. Mycoplasma spp. are common in the respiratory tract of sheep, and the combination of Mycoplasma ovi-pneumoniae and M. haemolytica A2 induces a proliferative subacute or chronic pneumonia in lambs. Bordetella peripertussis has recently been isolated from ovine lungs, and under experimental conditions can predispose to secondary M. haemolytica infections. Pathogenesis. The lower respiratory tract, including the lungs, are areas of the body which have to be continually protected against infectious agents. These colonizing agents usually arrive in the nasopharyngeal passages as aerosolized particles in inhaled environmental gases. They then become the source of infectious agents for the lower respiratory tract. The respiratory tract is, however, generally resistant to attacks by airborne pathogens. There exists a dynamic relationship between the innate clearance mechanisms of the host and the impairment of these mechanisms by the pathogens or other factors. The pathogenesis of pulmonary infections requires a number of stages: colonization of the upper respiratory tract, survival and growth of the agent, and colonization of the lung. In pasteurellosis in sheep and goats, the colonization of the upper respiratory tract is regularly achieved as M. haemolytica and P. trachelosi are frequently isolated from apparently healthy animals. Mannhemia haemolytica is capable of disrupting the innate defense mechanisms and the integrity of lung tissues in both sheep and goats through a number of mechanisms. A specific protease which cleaves Ig1. A specific leukotoxin which attacks the alveolar macrophages, one of the first mechanisms of host defense in the lungs. Capsular polysaccharide which has been shown to have antiphagocytic properties. Mucociliary clearance is a well-recognized mechanism for removing particles from the lower airways, and any conditions that adversely affect its operation will present an opportunity to pathogenic bacteria. Cold temperatures and virus infections are known either to slow down the velocity of the nasal mucus or destroy the epithelial cells in the trachea. Viral infections is thought to create an ideal environment consisting of necrotic cells and proteinaceous fluid in the lung, favoring bacterial growth by interfering with the mucociliary clearance mechanisms of the respiratory tract, and by depressing the capacity of resident lung macrophages to take up and kill bacteria. The subsequent M. Haemolytica infection is exacerbated by these events. In a proportion of cases, clinical signs are not noticed and the animal is found dead. In the early stages of flock infection, some animals may have a slight, serous, oculonasal discharge with an occasional soft cough. After this, more severe clinical signs of the disease occur. The clinical signs of acute pneumonic pasteurellosis are dullness, anorexia, pyrexia of greater than 46 degrees Celsius and varying degrees of hyperpnea or dyspnea. This dyspnea can be seen as exaggerated movement of the abdominal flank muscles, abdominal lift. On auscultation, adventitious sounds are not prominent and the respiratory sounds are loud and prolonged. There are often serous to mucopurulent nasal and ocular discharges. A frothy fluid drooling from the mouth is usually present in the terminal stages. The morbidity and mortality rates, however, rarely exceed 10%. In subacute or chronic cases, the clinical signs may be transient and less obvious than in the acute disease. Signs include coughing over a long period, dyspnea and hyperpnea which is exacerbated by exercise, illness and a mucopurulent nasal discharge. Lesions. The initial observation at necropsy of most adult sheep with pneumonic pasteurellosis is extensive ecchymotic hemorrhage in the throat region and over the ribs. On opening the thorax, subpleural and subepicardial petechiation and varying amounts of clear, yellow pleural and pericardial exudate are found. In peracute cases, the lungs are swollen, heavy and cyanotic, with bright purplish red solid areas which exude a frothy hemorrhagic fluid when incised. In cases of slightly longer duration, the lesions are those of an acute fibrinous pleuropneumonia. The lungs are consolidated particularly in their cranial and ventral parts and generally covered by a greenish-yellow, gelatinous pleural exudate. The consolidated portions of such lungs contain irregular greenish-brown areas of necrosis, each with a dark, hemorrhagic margin. The tracheobronchial mucosa in peracute and acute pneumonic pasteurellosis is red to dark purple and the airways contain pinkish stained froth. The pneumonic and pleural lesions are almost invariably accompanied by an acute fibrinous pericarditis. In less acute cases, grayish-pink, raised areas of consolidation in the cranial lobes predominate which, when incised, resemble liver in appearance and consistency, having red or gray solid lobular tissue prominently separated by thickened septa. In such tissue, necrotic foci and an overlaying pleuritis with organizing fibrinous adhesions between the parietal and visceral pleura may be present. Very occasionally the only lesions are solid, raised nodular masses scattered throughout the lungs. These may be mistaken for lung tumors, but histology reveals the characteristic pathology of pasteurellosis. The bronchial lymph nodes in pneumonic pasteurellosis are enlarged, soft and pale and may contain numerous petechiae. In lambs up to 12 weeks of age, haemolytica is associated with septicemia rather than a primary pneumonia. There may be either no lung involvement, or pleuritis and pericarditis with only focal areas of pneumonia. Pleuritis and pericarditis may be manifested. Petechiae, however, are usually present in the myocardium, spleen, kidneys and liver. The majority of lymph nodes are enlarged and hemorrhagic, and fatty degeneration of the liver is present. Histologically, in peracute cases the lungs are intensely hyperemic and hemorrhagic and a pale pink staining exudate rich in protein mingled with masses of gram-negative coccobacilli fills the alveoli. The acute consolidated pneumonic lesions are manifested by the presence of a widespread cellular exudate and an accompanying congestion and capillary hemorrhage. Clusters of neutrophils may occur, but the predominant cell filling the alveoli is elongated with an intensely basophilic spindle-shaped nucleus called an oat cell, masses of which form whorls and appear to stream between adjacent alveoli. When present, the characteristic necrotic lesions have a zonal structure with necrosis of all elements centrally surrounded by a dense layer of oat cells, macrophage-like cells and the products of cell death. Progressive stages of pleuritis are observed. The most acute type displays edema and a diffuse light mononuclear cell infiltration containing masses of coccobacilli, while a thick layer of fibrinocellular exudate characterizes the less acute form. Diagnosis. Pasteurellosis is the commonest cause of acute pneumonia in sheep, but only a provisional diagnosis should be made on clinical signs and history. The presence of haemolytica in nasal swabs is of no diagnostic significance and serology is not useful on either an individual or a flock basis. A diagnosis may be provisionally confirmed at necropsy by finding the acute inflammatory changes in the thorax and the characteristic hepatized and/or necrotic lung lesions. Further confirmation may be achieved by histological demonstration of lesions containing OAT cells. However, acute pneumonic pasteurellosis requires bacteriological confirmation, since other conditions, clostridial disease and even postmortem autolysis, may cause similarly congested, heavy lungs. Samples for bacteriological examination should be collected from untreated cases and include a range of sites as thoracic fluids, heart blood, lung lesions, kidney, spleen and liver. Routine serotyping of isolates of M. haemolytica is of little value, but can be useful in epidemiological studies and investigations into putative vaccine breakdowns. Molecular techniques such as pulsed field gel electrophoresis have better discriminatory powers than serotyping and may prove more useful in epidemiological studies. Differential diagnosis. Similar lesions may be encountered in pneumonia caused by other bacteria, notably P. multocida and rarely Escherichia coli. Aspiration pneumonia may be distinguished to some extent from M. haemolytica pneumonia on the basis of distribution, predilected involvement of the right cranial lobe, and the type of reaction, often gangrenous. Chronic pneumonia due to M. haemolytica should be differentiated clinically and pathologically from Yagsicta, pulmonary adenomatosis, pneumonia caused by Corynebacterium pseudotuberculosis or Truparella pyogenes, lungworm infestation and Visnemati. It must, however, be borne in mind that secondary bacterial pneumonia might complicate the clinical and pathological manifestations of the lung lesions in diseases such as Yagsicta, Mati and lungworm infestations. Control. Since pasteurellosis is sporadic, optimum control is achieved by vaccination. However, there are circumstances in which the use of antibiotics is useful, for instance in outbreaks of pasteurellosis in lambs during the period when passive immunity from colostrum has waned and active immunity is being generated by vaccination. Long-acting oxytetracycline has been shown to be effective therapeutically and prophylactically in experimentally infected lambs and under field conditions. Early commercial vaccines against pasteurellosis were bacterians and contained a very limited range of serotypes. New vaccines based on protein antigens which are involved in iron uptake are developed and available. Studies on the humoral and cell-mediated immune responses in the sera and lung washings of vaccinated and recovered lambs suggested that humoral immunity was the more important. This was confirmed by the finding that sera or immunoglobulins from infected or hyperimmunized sheep passively protected SPF lambs against aerosol challenge. Disease associated with Bibersteinia triholosi, systemic pasteurellosis. This is epidemiologically and pathogenetically distinct from the pneumonic form of pasteurellosis. Epidemiology. Most outbreaks of systemic pasteurellosis conform to a well-defined pattern. Disease affects 6 to 9-month-old sheep during October, November, and December. The onset of the disease frequently coincides with folding on rape or turnips or a change to improved pastures, and both circumstances have been postulated as predisposing causes. However, there is as yet no proof that they are so. A change to wet, cold weather has also been noted as a possible contributing factor. A typical episode usually starts with a number of sudden deaths, but the number of deaths then quickly drops over the next few days. The mortality rate is quite variable but seldom exceeds 10% of the flock. Sporadic deaths due to systemic pasteurellosis do occur at other times of the year and in all ages of sheep, but even less is known about the factors that predispose to these cases. Dietary changes induced erosions and ulcers of the gastrointestinal mucosa, which were the portals of entry of the infection leading to the systemic disease. Clinical signs. The main feature is sudden death, so that affected sheep are seldom seen alive. Those that are, usually are recumbent, extremely depressed, dyspneic and frothing at the mouth. This clinical description is consistent with that of endotoxic shock. Lesions. The carcass is usually that of a young sheep in good condition. Subcutaneous hemorrhages are found over the neck and thorax, and ecchymosis are also frequently seen in the pleura and diaphragm, or under the epicardium. The lungs are swollen and edematous with widespread focal hemorrhages, and frothy blood-tinged fluid exudes from the bronchioles. Consolidation is not a feature. Lesions also occur in the pharynx and upper alimentary tract. In the former site, they take the form of necrotic erosions, which are especially prominent around the tonsillar crypts. Similar erosions may be found also in the nasal mucosa, tongue or soft palate. Necrosis of the esophageal mucosa, with extensive sloughing of mucosa, may be present, and similar necrotic lesions are found variably in the omasum and rumen. The abomasum may contain considerable areas of hemorrhagic inflammation, or shallow hemorrhagic ulcers, most numerous at the pyloric end. Rarely, similar lesions may be seen in the duodenum. Lesions. The liver is usually swollen and congested and may contain numerous small, gray, necrotic foci scattered throughout its substance. Small infarcts may sometimes be seen in the spleen, and the kidneys appear blotchy. The tonsils and retropharyngeal lymph nodes are usually enlarged and edematous. Microscopically, the necrotic lesions in the pharynx and alimentary tract show necrosis of the mucosa with extensive sloughing. Underlying tissues are hyperemic but exhibit surprisingly little cellular reaction. Masses of gram-negative coccobacilli and gram-positive cocci can be seen adhering to the luminal surface of many ulcers or eroded areas, and similar masses occlude local vessels and lymphatics. Lesions in the lungs, liver, spleen, adrenals and, less frequently, kidneys can be attributed to the dissemination of bacterial emboli in the terminal arterial system. The lesions are focal and consist of masses of gram-negative coccobacilli, usually surrounded by zones of necrosis enclosed by basophilic spindle-shaped leukocytes, OAT cells. In the brain, serum protein leakage in the cerebrocortical leptomeninges, with mononuclear cell infiltrates in the choroid plexuses of the lateral and fourth ventricles have been reported. Diagnosis. The diagnosis of systemic pasteurellosis depends on the isolation and culture of large numbers of P. Trahalosi from the lungs, livers and spleens of sheep with the gross pathological changes described. Bibersteinia trahalosi can be isolated from the nasopharynges and tonsils of apparently normal sheep and in small numbers from other sites including the lungs, but their presence in these sites can be ignored. It should also be remembered that antibiotic therapy may reduce the numbers of bacteria and in the lesions. Control. Because of the epidemiology of the disease, control is best achieved by vaccination. As with pneumonic pasteurellosis, field trials are difficult due to the sporadic nature of the disease on individual farms from year to year. Most isolates of P. trahalosi are sensitive to oxytetracycline, but as sheep are rarely seen in the early stages of the disease, therapy is seldom possible and there are no reports on the value of prophylactic therapy. Since stress may play some part in predisposing to this disease, flock management should be designed to minimize the stress involved in changes of environment and nutrition during the late autumn and early winter. Other Mannhemia, haemolytica and Bibersteinia trahalosi infections. Mannhemia haemolytica is the cause of other pathological conditions, but these occur less frequently than pneumonic and systemic pasteurellosis. Strains of M. haemolytica and P. trahalosi have been isolated from cases of mastitis in ewes, and this condition is occasionally fatal. Arthritis is a common sequel to experimental intravenous inoculation of P. trahalosi and is also occasionally diagnosed in the field. Sporadic Mannhemia/Pasteurella meningitis affects ewes and lambs. Diagnosis of all these conditions depends on the isolation of large numbers of Mannhemia or Pasteurella cells from the lesions. Swine pasteurellosis may manifest as septicemic or pneumonic forms. Septicemic pasteurellosis occurs in both neonatal and juvenile pigs, while pneumonic pasteurellosis is a disease of predominantly juvenile animals. The infection, in conjunction with other infectious agents, Bordetella bronchoseptica in particular, is also implicated in the etiology of atrophic rhinitis. See Bordetella bronchoseptica infections, a syndrome peculiar to pigs. Etiology. In pigs, infection by Pasteurella multocida is more prevalent than that by Mannhemia, Pasteurella, haemolytica. Pasteurella multocida serotypes A and D predominate in isolates from specimens obtained from pigs that suffered from septicemia or pneumonia. Hemorrhagic septicemia caused by P. multocida serotype B has not been recorded in pigs all world regions. Whilst of rare occurrence in pigs, M. haemolytica, biotype and serotype undetermined, has been isolated from aborted fetuses and neonatal piglets suffering from septicemia, and from pneumonic lesions in juvenile pigs. Toxigenic strains of P. multocida serotype D are also associated with atrophic rhinitis in pigs. Septicemic pasteurellosis in pigs. Septicemic pasteurellosis caused by P. multocida has been reported in juvenile and adult pigs. Although specific pathogen-free animals are apparently at greatest risk, the prevalence of this form of the malady, irrespective of whether caused by P. multocida or M. haemolytica, is higher in neonatal pigs. The course of the disease is percute, death supervening after a period of illness that lasts no more than 12 hours in most cases, but rarely 24 to 48 hours. Clinical signs usually include bluish-red coloration of the snout skin, ears and ventral regions of the neck, flanks and abdomen, lowered habitus, fever, dyspnea and reluctance to move. Generalized congestion, cutaneous lividity, subcutaneous edema and petechiation, serosanguineous effusions in the body cavities and extensive ecchymotic hemorrhages in the lungs and epicardium are often present at necropsy. Acute catarrhal to fibrinous pharyngitis accompanied by peripharyngeal edema, severe congestion of the cranial cervical lymph nodes, and rarely, also acute fibrinous meningitis, particularly in neonatal pigs, may be encountered. Diagnosis is confirmed on the basis of isolation of bacterium in pure culture from specimens of blood, brain, or other suitable tissues, spleen, lymph nodes and liver. Differential diagnosis should include other diseases associated with sudden death, such as African swine fever, colobacillosis, salmonellosis, erysipelas, Haemophilus septicemia, streptococcal septicemia, porcine pleuropneumonia and leptospirosis. Specific antibiotherapy is hampered by the sporadic nature and acute course of the disease. Control may be best achieved by separating diseased animals from healthy susceptible pigs and improving in the standards of housing, nutrition and hygiene. Epidemiology. Pneumonic pasteurellosis is the most prevalent form of Pasteurella spp. Infection in pigs. Fattening pigs in overcrowded conditions are at greatest risk. As in other species, the causative organism is a normal constituent of the flora of the upper respiratory tract, and stress factors, such as overcrowding, transportation, commingling, handling, exposure to excessive amounts of environmental or feed dust, and poor hygienic conditions, sometimes in association with concomitant pulmonic infection, probably trigger dissemination of P. multocida to the lung parenchyma. Intercurrent viral and bacterial infections, such as hog cholera, Augeski's disease and swine influenza, and infections with Bordetella bronchoseptica, Actinobacillus pleuropneumoniae and Salmonella choleraesus have been implicated as predisposing factors in pig-producing countries in the world. However, enzootic mycoplasma pneumonia is the most important predisposing infectious condition on a worldwide basis. Pathogenesis. The available information on the pathogenesis of pneumonic pasteurellosis in pigs is incomplete and refers mostly to the infection as a complication of mycoplasma pneumonia. The infection is acquired through aerosol transmission. Injury to the lungs that has been induced by prior infection by Mycoplasma pneumoniae presumably provides not only a portal of entry for P. multocida but also the environment for local proliferation of the bacteria. Adherence to ciliated epithelial cells and evasion of phagocytosis by alveolar macrophages in the porcine respiratory tract are presumed to be functions of the capsule of P. multocida. The extent of the inflammatory reaction in the lungs is dependent upon the severity of the preceding injury and the quantum of bacteria that colonizes the lungs. Clinical signs. Clinical signs vary in intensity according to the severity and extent of the pneumonic process. Infections may be inapparent or associated with a dry, non-productive cough that may persist for weeks or months in mildly affected animals. More severely affected cases usually initially show a non-productive cough which becomes productive, and depression, inappetence, fever, dyspnea, and mucopurulent discharges from the nostrils. Auscultation reveals harsh pulmonary sounds. After a period of 5 to 10 days, pigs that suffer from severe disease almost inevitably die in the absence of effective antibacterial therapy. Recovery may be incomplete and characterized by persistent coughing that lasts for up to 5 weeks, emaciation and eventual death. Relapses may occur in fully recovered animals. Lesions. Acute, fibrinous pleuropneumonia succeeded by chronic, suppurative pneumonia is the usual course of events. The cranioventral areas of the lungs are most commonly affected, although the caudal lobes may also be involved. In acute disease, the affected lungs are consolidated, reddish-purple in color and frequently attached to the pleura and pericardium by fibrinous adhesions. The subpleural and interlobular tissues are distended by inflammatory edema. The regional lymph nodes are enlarged. The histological features include all the hallmarks of acute fibrinous bronchopneumonia, multifocal necrosis, and the presence of OAT cells or streaming macrophages. Gram-negative bacteria are present throughout the affected lungs. This reaction is frequently superimposed upon bronchointerstitial or cuffing pneumonia indicative of a preceding mycoplasma infection. Extrathoracic lesions may include generalized congestion, some degree of icterus, fibrinous or ulcerative pharyngitis and pronounced peripharyngeal edema, fibrinous pericarditis and polyarthritis. Emaciation, chronic suppurative pneumonia, bronchiectasis and extensive fibrosis are common sequelae of the acute disease, and may be complicated by chronic adhesive pleuritis and pericarditis, and chronic polyarthritis. A definitive diagnosis of pneumonic pasteurellosis is based on isolation of the causative organism from mucous nasal secretions and blood of clinically affected animals, or pneumonic tissues, blood, and pleural and pericardial exudates collected at necropsy. Porcine pleuropneumonia caused by Actinobacillus pleuropneumoniae should be considered as a possible differential diagnosis. Control. Parenteral administration of antimicrobial agents, sulfonamides or antibiotics, to affected pigs may be beneficial. This procedure should be supplemented by the provision of medicated feed or water for the entire group of pigs for 3 to 5 days. Certain strains of P. multocida are, however, resistant to some of the antibacterial agents in common usage, and it is preferable to treat according to the results obtained from an antibiogram. Although there is no specific vaccine available against pneumonic pasteurellosis in pigs, autogenous bacterians or live attenuated vaccines have been utilized with some success in other parts of the world. In addition, protection against the disease may be afforded by correcting husbandry procedures that are likely to predispose to the infection. These may include ensuring adequate housing, nutrition and hygiene, reducing commingling, handling and exposure to dusty conditions, and preventing the primary infections which predispose to secondary P. multocida infection of the porcine lung. Progressive atrophic rhinitis, PAR, is an important disease of pigs characterized by turbinate atrophy with varying degrees of facial deformation. It is caused by infection with toxigenic strains of Pasteurella multocida. Clinical disease can cause production losses due to growth retardation in fattening pigs. Subclinical disease also occurs. The etiology of PAR was long disputed, as various causes of turbinate atrophy have been identified. Infection with Bordetella bronchiseptica can cause severe rhinitis with turbinate atrophy in piglets less than 6 weeks old. However, it is accepted that the progressive form of the disease, which can affect older pigs, is caused only by toxigenic strains of P. multocida, although various factors including infection with B. bronchiseptica can predispose to PAR. The progressive nature of the disease probably depends upon chronic infection with toxigenic P. multocida, as turbinate atrophy experimentally induced by a single intraperitoneal administration of toxin resolved within approximately 3 months. Etiology. A toxin produced by particular strains of P. multocida is the cause of progressive turbinate atrophy in pigs, either alone or in combination with Bordetella bronchiseptica. Strains of Pasteurella multocida, both types A and D, cultured from pigs, rabbits and humans, have been identified that produce a thermolabeled dermonecrotic protein toxin. Identification of the gene that encodes for the toxin indicated that it may be located in a bacteriophage, transfer of which may be able to cause non-toxigenic strains to produce toxin. Epidemiology. Clinical PAR usually occurs in young pigs. Lesions decrease in severity with age, and infection of adults may result in subclinical disease with subsequent infection of piglets by their dams, 10 to 15% of which may be carriers. The highest prevalence of carriers was found in the 6 to 12 month age group. Introduction into clean herds is usually by means of carriers, which may shed organisms when stressed by transport and mixing with other pigs. Transmission is usually by direct nose-to-nose contact or aerosol, but, since toxin administered by various routes can produce lesions of PAR, and it appears that toxin can be produced in sites other than the nasal mucosa, infection by other routes may be possible. Toxigenic P. multocida is usually carried in the pharyngeal tonsils, but may be isolated from the nasal mucosa and the lungs. It has also been isolated from the vaginas of sows. Transmission between species might occur, but it has been suggested that this may not always result in disease. Although toxin produced by P. multocida is capable of producing typical lesions of PAR, colonization of the nasal mucosa is enhanced by the presence of B. bronchoseptica. However, vaccination with purified P. multocida toxin alone gave good protection against severe lesions of PAR. Damage induced by high levels of ammonia and dust also facilitates colonization. The severity of PAR, and indeed whether it will manifest clinically at all, depends on environmental factors and above all management. Toxigenic P. multocida has also been associated with pneumonia in pigs. Pathogenesis. Progressive atrophic rhinitis results from colonization by a toxigenic strain of P. multocida, followed by elaboration of the toxin which exerts a direct effect on turbinate growth. The pharyngeal tonsil is a predilection site for colonization by P. multocida. In the absence of damage to the nasal mucosa caused by chemical effects, such as those resulting from poor air quality or infection with B. bronchoseptica, colonization by P. multocida is poor. Very high doses of P. multocida toxin as well as infection with B. bronchoseptica and various chemical mediators cause ciliastasis, which facilitates colonization of the nasal mucosa. Colonization of the nasal mucosa by toxigenic P. multocida results in more severe lesions, but is not essential for the induction of PAR. Toxin produced in the tonsils or the lungs can also cause turbinate lesions. It has been demonstrated that not only intranasal but also subcutaneous, intramuscular and intraperitoneal administration of toxin can produce turbinate atrophy. Colonization of the nasal mucosa by toxigenic P. multocida results in epithelial hyperplasia and atrophy of mucosal glands, accompanied by an influx of neutrophils and mononuclear cells. The osteoporotic changes in the turbinate bones induced by the toxin are the result of increased bone resorption and impaired osteogenesis, characterized by decreased mineralization and replacement fibrosis. Increased osteoclasia induced by P. multocida toxin has been demonstrated to result from an increase in both numbers and activity of osteoclasts. The increase in number is attributed to the ability of the toxin to induce the differentiation of osteoclast-like cells from precursors in the bone marrow, possibly indirectly via cytokine production by a subpopulation of stromal cells. The marked effect on turbinate bones is probably due to the fact that these consist of endochondral bone with few trabeculae and a large amount of bone marrow that is actively hemopoietic. Stimulation of osteoclasia appears to be transient, which may explain why an increased number of osteoclasts is not always observed. The effects on osteoblasts appear to include cytolysis and impairment of differentiation and function. There is evidence that P. multocida toxin may prevent differentiation of precursor cells into osteoblasts. Ultrastructural studies revealed degenerative changes in differentiated osteoblasts. Cytolysis induced by P. multocida toxin appears to be dose-dependent. The way in which P. multocida toxin causes growth retardation has not been fully elucidated. It is generally accepted that PAR can result in growth retardation. Physial area and chondrocyte proliferation were reduced in piglets infected parenterally with P. multocida toxin. Clinical signs usually do not develop until piglets are 4 to 12 weeks of age. The first signs are sneezing and snuffling as a result of acute rhinitis. Piglets affected with PAR continue to sneeze and snuffle throughout the growing period, producing varying amounts of serous to mucopurulent nasal and ocular discharges. As a result of the ocular discharge, triangular dark stains, or tear marks, develop below the medial canthi of the eyes. Animals that are severely affected may suffer bouts of epistaxis, which is usually unilateral, and this may be evident from the presence of blood stains on the walls of the pens. Pieces of turbinate bone may be expelled during particularly violent sneezing. As the disease progresses, deformities of the snout may become evident. Shortening of the upper jaw, superior brachygnathism, is the most commonly observed deformity, with folding of the skin over the dorsum of the snout. Turbinate lesions may be asymmetrical, with deviation of the nasal septum, which causes deviation of the snout towards the side that is more severely affected. Growth retardation and poor feed conversion may occur in severely diseased pigs. In order to evaluate the turbinate lesions, snouts of slaughtered pigs should be cut, at the level of premolars 1 and 2 and examined in cross-section. Comparison with a normal snout cut at the same level facilitates evaluation of the severity of the lesions. The ventral conchae are the first to be affected, and may be so reduced in size to be absent. In severe cases the dorsal and ventral conchae are markedly reduced, and in very severely affected pigs the conchae may be absent. The lesions exhibit varying degrees of asymmetry. The nasal septum may be normal or deflected to one side, depending on the degree of asymmetry of the lesions. Other organs are usually normal, but signs of pneumonia may be present, as infection with Mycoplasma pneumoniae has been reported to predispose to PAR, and toxigenic P. multocida has also been isolated from pneumonic lesions. The toxin of P. multocida has also been demonstrated to cause thickening of the epithelium of the urinary bladder. Experimental infection with high doses of purified toxin resulted in icterus due to severe hepatocellular degeneration and necrosis, and gastric ulceration and polyencephalomalacia were also observed. Pigs suffering from clinical PAR may be smaller than their litter mates, have a dull hairy coat, and exhibit varying degrees of facial deformation as described above. Tear stains are often present and are suggestive of but not pathognomonic for PAR. Because the disease may be subclinical present in herds that have never shown any clinical signs of PAR, abattoir monitoring is frequently used to detect lesions suggestive of PAR. To facilitate diagnosis, various methods of scoring snouts have been developed, ranging from subjective scoring severity lesions on a 0 to 5 scale to more sophisticated methods to try to achieve an objective evaluation. The latter include morphometric approaches, and computer tomography scans. However, the cutoff point at which the lesion is classified as PAR remains a problem. In order to make a definitive diagnosis, involvement of toxigenic P. multocida must be confirmed in the laboratory. The highest number of organisms usually occurs in the tonsils, making this the specimen of choice for isolation and identification of the organism. Traditionally, confirmation of the diagnosis depended upon isolation of the organism, and subsequent testing in guinea pigs or mice to establish the production of dermonecrotic toxin, but this method has been superseded by an in vitro test in which varicells are employed to avoid the use of guinea pigs. These methods are slow, laborious and expensive. Culture of P. multocida is hampered by difficulty of growing it on solid media. The use of liquid or selective media is recommended. More modern techniques, in particular the polymerase chain reaction, PCR, technique are currently used. An ELISA has been developed in which monoclonal antibodies are used to detect the toxin. Both the ELISA and the PCR are highly sensitive and specific, as well as being faster than conventional tests. Since specific antibodies against P. multocida toxin are produced, tests to determine serum antibody levels can detect unvaccinated herds that have been exposed to infection. Serum neutralization tests and an ELISA have been developed. A skin test based on the presence of antitoxin antibodies has been developed. These tests are more useful for herd screening than for the detection of individual carrier pigs, since they depend on the response of the pig to antigenic stimulation, and furthermore do not necessarily imply active infection. In the absence of any clinical signs of PAR, detection of toxigenic P. multocida does not constitute a definitive diagnosis of PAR. It has been suggested, on the basis of identification of toxigenic P. multocida, in the prolonged absence of disease, in a closed herd in Ireland, that the strain identified, which differed from the usual strain that causes PAR in the UK, may have been derived from a different host and therefore did not spread and cause disease in pigs. Differential diagnosis. Acute rhinitis in young piglets has various causes, including B. bronchoseptica, inclusion body rhinitis caused by porcine cytomegalovirus, dusty feed, or poor environmental conditions. The diagnosis of PAR depends on isolation or detection of toxigenic P. multocida, and progression to development of lesions typical of PAR. Later stages of the disease must be differentiated from other causes of facial deformation such as abscesses, trauma to the nasal bones, and congenital conditions. These conditions are likely to affect individual animals only. Treatment during an outbreak of atrophic rhinitis is aimed at controlling the infection in pigs with clinical signs and preventing its spread in the herd by reducing the overall bacterial load. This should be accompanied by preventive measures that usually include vaccination and medication of sows, and improving the environment for the pigs, with particular attention to management of ventilation and housing. Various vaccines provide protection. Combinations of killed B. bronchoseptica cells and inactivated P. multocida organisms and toxin have been used with good effect. The P. multocida type D toxoid cross protects against type A. Good protection with this type of vaccine was reported after sows were vaccinated 5 to 6 and 2 to 3 weeks before farrowing, but a single vaccination in weaned piglets did not protect against challenge with cell-free toxin. The use of different adjuvants does not appear to affect vaccine efficacy. Toxin purified with monoclonal antibodies alone is capable of protecting piglets against infection with B. bronchoseptica and toxigenic P. multocida. Promising results have been obtained with a recombinant vaccine. Commercial vaccines are widely available. Medication may be used alone or in combination with vaccination to treat or prevent PAR. A wide variety of antimicrobials has proved effective against PAR. Potentiated sulfonamides, oxytetracycline, penicillin/streptomycin combinations, lincomycin and spectinomycin combinations, tilmycin, and enrofloxacin have all been reported to be efficacious. Control. To eradicate PAR from infected sow herds, vaccination over a period of at least 4 years combined with testing nasal and tonsillar swabs, using polymerase chain reaction, PCR, or a combination of the PCR and antigen-detecting ELISA, has been advocated. This should be combined with purchasing new stock only from herds known to be free of PAR. Screening to ensure freedom from carriers is performed by obtaining nasal and tonsillar swabs, as well as tonsillar biopsies, from the entire breeding herd to ensure freedom from infection. Measures are necessary to prevent introduction of PAR into naive herds by carrier pigs. New stock should be acquired from herds known to be free of the disease, if an accreditation system exists. New pigs should be quarantined separately from the herd for at least 6 weeks, and nasal and tonsillar swabs taken for bacteriological testing should prove negative before the pigs are introduced into the herd. Management is very important in the prevention of clinical PAR. Poor air quality in the farrowing unit, mixing of animals of different ages, and high stocking densities, particularly in continuous flow systems, predispose to PAR. The genus Yersinia is named after Alexandre Yersin, a French bacteriologist, who first isolated the plague bacillus in Hong Kong in 1894 while investigating a catastrophic epidemic of bubonic plague that killed an estimated 60,000 people. He named the bacterium Pasteurella pestis. Taxonomical revision now places this organism in the Yersinia genus, the oldest member of which is Y. Pseudotuberculosis, so named because Malasset and Venal described a disease in guinea pigs characterized by nodules in internal organs resembling tuberculosis. Yersinia enterocolytica has undergone a number of name changes since it was first isolated by McIver and Pike, and called Flavobacterium pseudomallii. Since then, it has been named Bacterium enterocolyticum, Pasteurella pseudotuberculosis X, Pasteurella pseudotuberculosis atypic, Pasteurella pseudotuberculosis type B and Leigh-Germes X. Frederickson demonstrated that these strains are separate species which he named Yersinia enterocolytica, and at the same time proposed that the genus Yersinia be included in the family Enterobacteriaceae. The relationship between Y. pestis, Y. pseudotuberculosis and other Yersinia spp. Was defined by DNA hybridization studies. Yersinia pseudotuberculosis infections occur in a wide range of mammalian and avian species, and epidemics in laboratory animals and captive birds are common, particularly in the northern hemisphere. There is a hypothesis that the emergence of Y. Pseudotuberculosis, which has a very close antigenic relationship to Y. pestis, may have limited the spread of plague in the last pandemic in Europe, and that the spread of infection to other parts of the world is due to shipments of livestock and bird migration. Yersinia spp. Pathogenic to livestock include Y. pseudotuberculosis and Y. enterocolytica. Yersinia pseudotuberculosis causes sporadic outbreaks of gastroenterocolitis and/or abortion in cattle, sheep, goats and farm deer. Y. enterocolytica, which is generally less virulent than Y. pseudotuberculosis, has been incriminated in outbreaks of enterocolitis in sheep, goats and pigs. Strains of these organisms also cause enteric infections in humans and non-human primates. Livestock infections with Y. enterocolytica and Y. pseudotuberculosis have been reported principally from New Zealand and Australia but also from many other regions including Canada, the UK, Nigeria, China, Russia, India, and Brazil. Infections with these organisms have not been recorded in Africa. Various other Yersinia spp, considered non-pathogenic, are periodically isolated. They are found as commensals in the intestine, soil and water. Members of the genus Yersinia are gram-negative coccobacilli, short rods or ovoid in form, ranging in size from 0,5 to 1 × 1 to 3 microns. Ovoid forms tend to be bipolar. The organisms are aerobic and facultatively anaerobic. They do not form endospores or true capsules. The production of flagella depends on the temperature of incubation, being absent at 37 degrees Celsius but occurring at 22 degrees Celsius, except in the case of Y. pestis which is non-motile at both temperatures. Using conventional media, Yersinia spp. are infrequently isolated because the colonies they produce after 48 hours of incubation are very small and easily overgrown by normal flora. However, Y. enterocolytica and Y. pseudotuberculosis outgrow competitive microflora at 4 degrees Celsius, and this feature is embodied in a technique known as cold enrichment. A two-step enrichment procedure is superior to other methods for the recovery of pathogenic Y. enterocolytica serotypes. The ability of Y. enterocolytica and Y. pseudotuberculosis, some strains of which are human pathogens, to survive and multiply at 4 degrees Celsius, the temperature used for the preservation of chilled food, makes them of concern to the human food industry. Yersinia spp. are catalase and oxidase negative. Acid is produced by fermentation of various carbohydrate substrates. Proteolytic activity is variable, as is production of urease. Nitrates are usually reduced. The DNA base composition is within the range 46 to 49% GC. Biochemical tests are used to distinguish Yersinia spp. from other bacterial genera and to differentiate the various species. Yersinia enterocolytica is a heterogeneous species, and a number of biotyping schemes differentiates the species into 5 biotypes. All biotypes have been associated with livestock infections, but biotype 5 is the most frequently recovered. In addition to biotyping, the other phenotypic method used to differentiate strains of Y. enterocolytica is serotyping, using antibodies raised in rabbits to lipopolysaccharide O antigens in a slide agglutination test. Although over 30 O factors have been described, only a few are found in pathogenic strains. Commercial antisera, including O:3, O:5, and O:9, are available for use in slide agglutination tests. A combination of biotyping and serotyping, bioserotyping, is usually used to characterize Y. enterocolytica strains for epidemiological purposes. Animal infections are predominantly associated with bioserotypes 2/O:9, 2/O:5,27, 3/O:5,27, 4/O:3 and 5/O:2,3. All except bioserotype 5/O:2,3 are also frequently recovered from human infections. Although all serotypes are considered pathogenic, animal infections are commonly associated with either serotypes 1, 2 or 3 and commercial antisera are available for these. Yersinia pseudotuberculosis is a homogeneous species, with biochemical differences only seen between strains in serotype 3, where melibbiose positive and melibbiose negative strains are recognized. Melibbiose negative strains have been reported to be less pathogenic than melibbiose positive ones. Yersinia spp. have been isolated from the feces of healthy cattle, sheep, goats, feral and farmed deer. In surveys of fecal samples from healthy cattle, sheep, goats and farmed deer, the prevalence rate of Yersinia spp. is highest in young animals, and ranges from 0 to 50%. Experimental challenge of recently weaned calves or sheep with Y. Pseudotuberculosis can lead to the establishment of enteric colonization and microscopic lesions in the lamina propria, as well as seroconversion in the absence of clinical disease. Consequently, apparently healthy animals may be subclinically infected and fecal isolates from such animals should be interpreted with caution. Older animals are likely to be immune. Strains of Y. Enterocolitica are frequently found in the throats of healthy pigs. Pigs are the natural reservoir of human pathogenic Y. Enterocolitica strains, particularly bioserotypes 2/0:9 and 4/0:3. Although rare, reports of Y. Enterocolitica infections in pigs have been encountered. Pigs are not prone to develop serious disease as they are capable of restricting the colonization of Y. Enterocolitica to the throat and intestinal tract. Similarly, Y. pseudotuberculosis, which can be readily isolated from healthy pigs, can also occasionally be recovered from diseased animals. Pigs are believed to be the natural reservoir of Y. Pseudotuberculosis serotype 3. Strains of Y. Pseudotuberculosis can cause disease, in decreasing order of prevalence, in farmed deer, cattle, goats, sheep and pigs. Serotype 3 is the most prevalent strain in cattle, sheep, goats and pigs, followed by serotypes 1 and 2. Disease mainly involves young animals after weaning. Maternally derived antibodies probably protect animals during the first weeks and months of life. The major way of transmission is the orofecal route. Both Y. Enterocolitica and Y. Pseudotuberculosis grow well in cold, wet conditions. These conditions may enhance the pathogenicity of Yersinia as enterotoxin production, by increasing room temperature down to 4 degrees Celsius. Y. Enterocolitica infections in sheep occur throughout the year. Yersinia pseudotuberculosis infections in sheep and cattle, on the other hand, occur mainly in the cooler months, as winter and spring, and this seasonality possibly reflects the enhanced survival of the bacteria during that time of the year. Predisposing factors for yersiniosis outbreaks include heavy rainfall or flooding, cold weather, high summer temperatures, recent transportation, introduction of new animals, intensive stocking rates, nutritional stress, changes in husbandry, weaning, shearing and concurrent parasitism. Piggery effluent or the contamination of feed with the feces, or carcasses of infected rodents or birds, may be a source of infection for sheep and other animals. Infected animals with diarrhea are likely to cause heavy environmental contamination, with rapid exposure of susceptible animals. Pathogenesis. Yersinia enterocolitica and Y. Pseudotuberculosis are facultative intracellular pathogens that multiply primarily in the mononuclear phagocytic system of the host animal. Organisms gain entry to the body via the oral route. Virulent strains invade the intestinal mucosa by means of invasion genes such as INV and ALE, equals attachment invasion locus. These genes are lacking in non-pathogenic strains that consequently lack the ability to invade host cells. The pathogenicity of Y. Pseudotuberculosis and Y. Enterocolitica strains also depends on a virulence-associated 40 to 48 megadaltons plasmid. Non-pathogenic Yersinia lack these plasmids. Several properties associated with the plasmid that enhance the virulence of the organism have been identified. For example, proteins are encoded for that inhibit phagocytosis and bacterial killing by host cells and which determine calcium and temperature dependency. Strains harboring the plasmid are calcium dependent when grown at 37 degrees Celsius, but not at 25 degrees Celsius. Both species also synthesize virulence-associated V and W antigens, as does Y. pestis. Pathogenic strains of Y. Enterocolitica produce a heat-stable enterotoxin, and some strains of Y. Pseudotuberculosis, Serotype 3, produce an exotoxin. Chromosomally encoded features of virulent Y. Enterocolytica include Fimbriae, iron uptake systems and urease activity. Virulent strains of both Y. Pseudotuberculosis and Y. Enterocolytica produce typical microabscesses in the intestinal mucosa of susceptible animals, whereas virulent strains do not. From the intestinal tract, organisms spread via the lymphatics to cause a mesenteric lymphadenitis and can then disseminate further through the portal veins to cause a bacteremia and necrotic foci in the liver, spleen, lungs and/or other organs. In endemic areas, most animals will acquire infection in the first 2 years of life. Variations in the prevalence of infection could be due to differences in the persistence of maternally derived immunity, the magnitude of challenge or the level of acquired immunity from a previous subclinical infection. Infection of sheep with Y. Pseudotuberculosis does not induce cross-immunity to Y. Enterocolytica. Pre-existing gastrointestinal mucosal lesions, such as those caused by parasitism, may aid infection by Yersinia. Disease may also result when cell-mediated immunity is compromised or when a latent infection is reactivated. Yersinia infections in cattle are restricted to the gastrointestinal tract in most cases. Yersinia pseudotuberculosis is more commonly isolated from cattle than Yersinia enterocolytica, which is rarely isolated from diarrheic animals. The course of the disease is usually acute or subacute. Affected animals show depression, diarrhea, dehydration, pyrexia and recumbency or may be found dead. The feces are fetid, watery and profuse and may be blood-flecked. More than one animal is usually affected. In some cases, however, the course may be more chronic, with affected animals being in poor condition. Hematological examination may reveal a neutrophilia with a left shift and an increased fibrinogen concentration. Sporadic outbreaks of enterocolitis in older calves, yearlings and young or adult cattle are characterized by hyperemia of the abomasum and intestinal mucosa, with occasional small ulcers present in the abomasum. The small and large intestines are generally dilated and filled with fluid, light green to tan contents, which may be frothy. Raised nodules, with depressed centers may be present in the mucosa of the large intestine, and the mesenteric lymph nodes are enlarged, congested, and edematous. Histologically, sections of the intestine show numerous, scattered, multifocal microabscesses in the superficial lamina propria and Peyer's patches. These lesions comprise a dense aggregation of neutrophils and necrotic tissue surrounding colonies of gram-negative coccobacilli. They may be present in both the small and large intestines, but are often confined to the former. Sometimes the lesions are more serifibrinous, with multifocal superficial suppuration and necrosis of the intestinal epithelium, together with numerous bacterial colonies. Microabscesses or small pyogranulomas, which may contain bacterial colonies, may be evident in the subcapsular and medullary sinuses of mesenteric lymph nodes. Foci of necrosis may also be seen in the liver. The pathology may be more striking in cases where the Yersinia infection is more fulminant. Lesions in subacute or chronic cases are generally less conspicuous. Yersinia pseudotuberculosis septicemia occurs in cattle with lodgement of organisms in the gravid uterus, leading to abortion and, in some cases, pneumonia. Aborted bovine fetuses show minimal autolysis, and have excessive amber fluid, which may contain fibrin strands, in body cavities. Pale tan to white foci of necrosis, ranging from 0,1 to 10 mm in diameter, may be seen in the fetal liver or lungs. Histologically, necrotic foci associated with bacteria may be evident in the liver and hepatic lymph nodes, while the fetal lung shows a diffuse bronchopneumonia with mixed inflammatory cells, including multinucleate giant cells, in airways. The lung lesions may be multifocal and fibrinopurulent to necrotizing and associated with bacteria. In the conjunctiva, infiltrations of mononuclear cells, plasma cells and a few neutrophils may be seen in the lamina propria. In the fetal colon, the lamina propria and submucosa contain large numbers of plasma cells and mononuclear cells, and colonies of bacteria and inflammatory cells may be visible in the meconium. Cotyledons are red or tan and show varying degrees of necrosis. The intercotyledonary region is translucent or edematous, and there may be some paracotyledonary fibrin. Portions of the maternal caruncle may remain attached. Histologically, the placenta shows necrosis, fibrinoid necrotic vasculitis and hemorrhage with suppuration and mononuclear cell infiltration in the cotyledons. Nutrients in the caruncle may favor colonization of Yersinia leading to villus infarction and chorionic invasion. Thrombosis, hemorrhages and necrosis are present in caruncle remnants. Yersinia pseudotuberculosis serotype 2 is a rare cause of mastitis. Sheep outbreaks of enterocolitis due to Y. Pseudotuberculosis and Y. Enterocolitica have been reported. Fecal excretion occurs 2 to 7 days after oral exposure with either organism. Both organisms cause similar lesions, but Y. Pseudotuberculosis is reported to be the more virulent of the two. As with cattle, the sheep disease is usually acute or subacute. Affected animals are depressed, anorexic and in poor condition, and may have a watery, non-bloody and foul-smelling diarrhea. Morbidity rate varies from 1,0 to 90% and mortality rate ranges from 0 to 7%. The abomasum and colon are reddened, the wall of the latter may be thickened and the contents are fluid and green or blood-stained. The lesions are more prevalent in the jejunum and ileum. Mesenteric lymph nodes are enlarged, congested and edematous. The microscopic lesions in the intestine resemble those seen in cattle, suppurative enterocolitis, characterized by microabscesses, which surround colonies of gram-negative bipolar organisms in the lamina propria. Leakage of albumin into the intestinal lumen leads to the hypoalbuminemia and contributes to the diarrhea. Occasional microscopic necrotic foci may be seen in the liver and mesenteric lymph nodes of sheep and goats infected with Y. Pseudotuberculosis. Rare findings in sheep include epididymoarchitis in rams, caseous pseudotubercles in the spleen and liver, multifocal suppurative nephritis and erosive cholecystitis. Yersinia intermedia and Y. Fredericksenii, usually considered to be environmental and non-pathogenic, have occasionally been isolated from cases of diarrhea and ill thrift in sheep. Yersinia pseudotuberculosis serotype 3 and, less commonly, Y. Enterocolitica can cause placentitis, abortion, stillbirth and neonatal death. Ewes that abort appear clinically normal. Affected fetuses have subcutaneous edema, serosanguinous fluid, sometimes containing fibrin strands, in body cavities and small, 2 mm diameter or less, yellowish, necrotic or pyogranulomatous foci in the liver, and sometimes in the spleen, kidneys and mesenteric lymph nodes, with multiple hemorrhages in the lungs, kidneys and intestines. Necrogranulomatous foci may also be present in the heart. The lungs may reveal a suppurative bronchiolitis and alveolitis and necrotic arteritis. Gram-negative coccobacilli are present in many of the necrotic foci. An acute purulent leptomeningitis and ependymitis may also be present. The intercotyledonary chorioallantois of the placenta may be thickened and ulcerated and covered with a yellowish, necrotic exudate, and some cotyledons may be necrotic. Diffuse inflammation, vasculitis and thrombosis are discernible histologically. Infected pregnant ewes, the uterine and placental lesions include thrombosis, necrosis and severe suppuration in the caruncles and similar changes in the cotyledons. Judging by the severity of lesions and the concentration of bacteria, the placenta and gravid uterus are very susceptible to Yersinia pseudotuberculosis infection. In contrast, infection of pregnant ewes with Yersinia enterocolitica, which is of low natural pathogenicity for the uterus, results in an infection which evolves slowly and only culminates in placental failure and fetal death when the effects of infection are superimposed on the normal decline in placental function at the end of gestation. Septicemia or endotoxemia may kill the ewe as well. In goats, Yersinia enterocolitica causes a similar enterocolitis to that seen in sheep. This disease is the most common infectious cause of death in Angora and other fiber-producing goat breeds less than 20 months old in New Zealand. Yersinia pseudotuberculosis, serotypes 1 and 3, can also cause enterocolitis as in sheep, and this organism has occasionally been isolated from cases of abortion and early neonatal death of goat kids. Fetuses may be autolyzed or fresh, and the placenta may reveal whitish foci of necrosis in the cotyledons. Histologically, there is suppuration in the placenta and in the fetal lung. Yersinia pseudotuberculosis, serotype 3, has also been associated with mastitis in milking goats, enteritis and acute ulcerative conjunctivitis with swelling of the parotid gland in kids. In farmed deer, Yersinia pseudotuberculosis, serotypes 1, 2 and 3, is the most common infectious cause of death in New Zealand and Australia. Outbreaks of yersiniosis in farmed cervids have also been reported from Canada. Clinical signs: gross pathology and histopathology closely resemble those seen in domestic ruminants. Infection of deer with Yersinia enterocolytica is usually asymptomatic. Pigs are usually asymptomatic carriers of Yersinia, but there are rare clinical reports of diarrheal disease associated with Yersinia enterocolytica originating from Australia and China. Diarrhea and enterocolitis or multiple systemic abscesses and pseudotubercles have been associated with Yersinia pseudotuberculosis. In outbreaks of diarrhea, enterocolitis and ill thrift due to Yersinia pseudotuberculosis serotype 3, in 8 to 18-week-old pigs, the feces ranged from unformed and gray to a watery, non-bloody diarrhea. Multifocal hemorrhages were present in the ileal mucosa. Histopathological: the lesion was a subacute enterocolitis with multiple microabscesses and colonies of gram-negative coccobacilli in the intestinal lamina propria, and an associated locally extensive polymorphonuclear leukocyte infiltration. Yersinia pseudotuberculosis is a rare cause of disease in horses. Serotype IA has been isolated from a 10-week-old foal with numerous small abscesses in the liver, spleen and lungs. More recently, an outbreak of diarrhea and pneumonia in foals caused by Yersinia pseudotuberculosis was reported from a stud farm in Poland. 10% of affected foals died. The clinical signs and gross pathology are not sufficiently distinctive for diagnostic. The characteristic microscopic enteric lesions, however, can be useful in suspicion diagnostic of infections in livestock. Consequently, bacterial isolation, identification and serotyping are essential. Fresh fecal samples, intestinal contents and mesenteric lymph nodes are the most appropriate samples for bacteriology. In cases of abortion, organisms can be cultured from the fetal abomasum contents and a wide variety of tissues, including liver, lungs and kidneys, and placenta and vaginal discharge. Serological diagnosis of subclinical Yersinia infections in lambs has been demonstrated using an enzyme immunoassay that measured antibodies to outer membrane proteins. Serological cross-reactions occur between Yersinia enterocolytica bio serotype 2/O:9 and Brucella abortus, and these have been shown to be due to the sugar moiety of the lipopolysaccharide in the cell wall. In some cases, these cross-reactions have prompted the search for the presence of Yersinia enterocolytica 2/O:9 in the feces of cattle and pigs presenting false positive reactions in brucellosis screening tests. A skin test has been developed that clearly eliminates brucellosis from false positive serological reactions due to infection with Yersinia enterocolytica. Differential diagnosis. In cattle, sheep and goats, diarrhea due to yersiniosis should be differentiated from that caused by salmonellosis, campylobacteriosis, Wiener colitis in sheep, coccidiosis, helminthiasis and, in the case of young cattle, bovine virus diarrhea. The microscopic enteric lesions due to yersiniosis, however, are distinctive and they are not a feature of either coccidiosis or salmonellosis. The latter is generally more severe, with erosion, ulceration and fibrinous effusion occurring. In sheep and cattle, abortion caused by Y. Pseudotuberculosis may resemble that caused by Campylobacter spp, Salmonella cerevars, Listeria monocytogenes, Pasteurella multocida and Toxoplasma gondii, and Brucella abortus, Campylobacter fetus, Salmonella cerevars, Bacillus licheniformis, Aspergillus and Mortierella wolfii, respectively. The placentitis due to Yersinia pseudotuberculosis closely resembles that due to Chlamydophila abortus, the cause of enzootic abortion of ewes. Swine dysentery, salmonellosis, intestinal adenomatosis and postweaning colobacillosis should be considered as differential diagnoses for diarrhea due to yersiniosis in pigs. Control. Known predisposing factors, such as parasitism, nutritional stress, lack of shelter, and the presence of rodents, should be addressed. Good nutrition is important in avoiding clinical disease. Treatment with long-acting antibiotics is recommended in the treatment of both yersiniosis Diarrhea increases the susceptibility of sheep to fly strike. Acquired immunity follows natural infection. Since antibodies to outer membrane proteins are found in animals and appear to be protective, vaccination are useful. Vaccination of mares and their offspring with a formalin inactivated culture of Yersinia pseudotuberculosis was employed following an outbreak of yersiniosis. A commercial vaccine, Yersiniavax, has been developed for use in farmed deer. A formalin inactivated bacterium with an oil adjuvant containing Yersinia pseudotuberculosis serotypes 1, 2 and 3, and a 2-dose regime, given 3 to 6 weeks apart, has been shown to give significant protection against heavy experimental and field challenge. It is recommended for use in young deer, and should be administered at least 4 to 7 weeks before the period of maximum stress, in autumn. Vaccination should be repeated annually. Tularemia is a zoonosis caused by Francisella tularensis antigenically related to Brucella spp. Tularemia is primarily a disease of the orders Lagomorpha and Rodentia, but a wide range of other mammals and several species of birds have also been reported to be infected. Hematophagus arthropods have a substantial role in the maintenance and transmission of Francisella tularensis. The disease is characterized by fever, depression and often septicemia. In humans, there may be ulcers or abscesses at the site of exposure, this is rarely seen in animals, and swelling of the regional lymph nodes. Oropharyngeal and pneumonic infections can be caused by ingestion of contaminated food and water or inhalation of aerosols, respectively. On postmortem examination, lesions may include caseous necrosis of lymph nodes and multiple grayish-white foci of necrosis in the spleen, liver, lungs, pericardium, kidneys and other organs. The spleen is enlarged in septicemic cases. The disease spreads through vectors such as mosquitoes, horseflies, deer flies, and ticks. Humans have a high risk of acquiring the disease through direct contact with sick animals, infected tissues, consumption of infected animals, drinking or direct contact with contaminated water, and inhalation of bacteria-loaded aerosols. Francisella tularensis, the causative bacterium, is a gram-negative coccoid rod, non-motile and non-spore-forming organism that is an obligate aerobe with optimal growth at 37 degrees Celsius. It is oxidase negative, weakly catalase positive, and cysteine is required for growth. It can be cultured readily on blood supplemented with cysteine but must be differentiated from other gram-negative bacteria on blood agar. The organism is highly fastidious. For growth it is necessary to use Francis medium, McCoy and Chapin medium, or modified Thayer-Martin agar. In certain cases, isolation from tissues or carcasses, the use of selective medium containing antibiotics or mouse inoculation is needed to aid successful isolation. The colonies are small, round and transparent, and do not appear before 48 hours incubation at 37 degrees Celsius. If transportation is necessary, samples should be inoculated into sterile nutrient broth and stored at 4 to 10 degrees Celsius for a few hours or on dry ice if transit is likely to be prolonged. The most relevant types of Francisella tularensis are recognized on the basis of culture characteristics, epidemiology, and virulence are Francisella tularensis subspecies tularensis, type A, and Francisella tularensis subspecies holarctica, type B. And a third Francisella tularensis subspecies novicida, type C, associated with low virulence and is less common than the other two. Epidemiology. Among domestic animals, clinical infection of tularemia has been reported in sheep, cats, dogs, pigs, and horses. Cats are at increased risk because of predatory behavior on small mammal hosts and appear to have an increased susceptibility, whereas cattle appear to be resistant. Little is known of the true incidence and spectrum of clinical disease in domesticated animals. Important wild animal hosts for Francisella tularensis include cottontail and jackrabbits, whereas the most common vectors are the ticks as the wood tick, the lone star tick, the American dog tick, and the deer fly. Animal hosts of Francisella tularensis holarctica are numerous, including lagomorphs, beaver, muskrat, voles, and sheep. Ticks, flies, fleas, and exposure to contaminated water sources are all associated with transmission of this subspecies, which has also been found to persist naturally in a water-associated amoeba. Natural foci of infection exist in North America and Eurasia. Although found in every state except Hawaii, tularemia is most often reported in the south-central and western USA, California, Missouri, Oklahoma, South Dakota, and Montana. Tularemia can be transmitted by aerosol, direct contact, ingestion, or arthropods. Inhalation of aerosolized organisms, in the laboratory or as an airborne agent in an act of bioterrorism, can produce a pneumonic clinical presentation. Direct contact with, or ingestion of, infected carcasses of wild animals, cottontail rabbit, can produce the ulceroglandular, oculoglandular, oropharyngeal, local lesion with regional lymphadenitis, or typhoidal forms. Immersion in or ingestion of contaminated water can result in infection in aquatic animals. Tularemia is a zoonosis caused by Francisella tularensis. It occurs naturally in logomorphs, rabbits and hares, and rodents, especially microtine rodents such as voles, vole rats and muskrats, and also in beavers. In addition, a wide variety of other mammals have been reported to be infected, and the organism has been isolated from birds, fishes, amphibians, arthropods, and protozoa. Tularemia occurs endemically in the northern hemisphere. The disease can occur as epizootic outbreaks in many countries in North America, while it occurs only as sporadic cases in some other countries in Europe and Asia. It is rarely reported from the tropics or the southern hemisphere. The two clinically most relevant types of Francisella tularensis are recognized on the basis of culture characteristics, epidemiology, and virulence. Francisella tularensis subspecies tularensis, type A, is mainly associated with logomorphs in North America and is primarily transmitted by ticks or biting flies or by direct contact with infected animals. It is highly virulent for humans and domestic rabbits, and most isolates ferment glycerol. Francisella tularensis subspecies holarctica, type B, occurs mainly in aquatic rodents, beavers, muskrats, and voles in North America, and in logomorphs, hares, and rodents in Eurasia. It has also been found in possums in Australia. It is primarily transmitted by direct contact or by arthropods, primarily ticks and mosquitoes, but may also be transmitted through inhalation or through infected water or food. It is less virulent for humans and domestic rabbits. In sensitive animals, clinical signs of severe depression are followed by a fatal septicemia. The course of the disease lasts approximately 2 to 10 days, and animals are usually dead when presented for diagnosis. Most domestic species do not usually manifest signs of tularemia infection, but they do develop specific antibodies to the organism following infection. Outbreaks with high mortality caused by the type A organism have occurred in sheep. Among domestic pets, F. tularensis infection can result in clinical illness in cats but less commonly in dogs. Both have been implicated in transmission of the disease to humans. Transmission from cats to humans occurs most commonly via bites or scratches and from dogs via close facial contact, ticks, and retrieved carcasses, as well as bites. The clinical presentation of tularemia depends on the host species, subspecies of the bacteria, and route of infection. Type A tularemia is particularly pathogenic for logomorphs, with fatal infections reported in cats and non-human primates. Sheep and cats may be subclinically infected or develop bacteremia, fever, and respiratory infection. Cats may also develop ulceroglandular or oropharyngeal disease, presumably through exposure to infected prey items. Clinical signs include increased pulse and respiratory rates, coughing, diarrhea, oral ulceration, polyuria with lymphadenopathy and hepatosplenomegaly. Prostration and death may occur in a few hours or days. Sporadic cases are best recognized by signs of septicemia. Outbreaks in untreated lambs may have up to 15% mortality. At necropsy, animals that have died from acute tularemia are usually in good body condition, but signs of septicemia characterized by whitish foci of necrosis randomly distributed in the liver, bone marrow and spleen, are evident. In addition, the spleen is usually enlarged. Necrotic foci vary in size, with some barely visible to the naked eye. The lungs are usually congested and edematous, and areas of consolidation and fibrinous pneumonia or pleuritis may be present. Fibrin may be present in the abdominal cavity. Foci of caseous necrosis are often present in one or more lymph nodes. Those most often affected are lymph nodes in the abdominal and pleural cavities, and lymph nodes draining the extremities. In less sensitive species, the macroscopic lesions can resemble that of tuberculosis with subacute or chronic granulomas in the lungs, pericardium, kidneys, spleen and liver. Macrophages are the dominant constituent cell type in the granulomas, but other cells including lymphocytes, heterophil granulocytes, multinucleated giant cells and fibrocytes are also found occasionally. Focal or multifocal necrosis is often observed in the center of these lesions. Diagnostic. Polymerase chain reaction is a safe and convenient method of detection and identification of Francisella tularensis in clinical specimens. The bacterium can be demonstrated in impression smears, or in fixed specimens of organs using a specific fluorescent antibody tests, T or immunohistochemistry. With gram staining, the bacteria appear as very small punctiform gram-negative rods, often difficult to distinguish. The organism is highly fastidious. For cultivation it is necessary to use Francis medium, McCoy and Chapin medium, or modified Thayer-Martin agar. In certain cases, isolation from tissues or carcasses, the use of selective medium containing antibiotics or mouse inoculation is needed to aid successful isolation. The colonies are small, round and transparent, and do not appear before 48 hours incubation at 37 degrees Celsius. Serological tests are useful for diagnosing human infection, but are of limited value in the more susceptible animal species that usually die before developing antibodies. Serological surveys can be conducted in relatively resistant species that survive the infection and develop antibodies, such as sheep, cattle, pigs, dogs, cats, wild ungulates, foxes and wild boars. Relatively resistant species of rodents and logomorphs can also be included in serological surveys. Treatment and control. Antibiotics can be effective if begun early. Control involves reducing exposure to wildlife and ticks. Early treatment is important to minimize risk of fatality. Streptomycin, gentamicin, and tetracyclines are effective at recommended dosage levels. Gentamicin should be continued for 10 days. Because tetracycline and chloramphenicol are bacteriostatic, they should be continued for 14 days to minimize the risk of relapse. Because of the substantial sylvatic, wildlife and tick component of the Francisella life cycle, control involves reducing arthropod infestations and limiting exposure to wildlife, for example by keeping cats and dogs indoors. In some countries, tularemia in animals is reportable to public health authorities.